A provider orders a stat chemistry panel, but the analyzer flags critical hemolysis once the specimen arrives. What is the most appropriate action by the medical assistant? A. Report the analyzer result and annotate hemolyzed. B. Redraw the specimen immediately using a different collection technique. C. Spin the sample again to reduce hemolysis. D. Release the result after verbal approval from the provider. Answer: B. Hemolysis invalidates many chemistry tests, potassium, AST, LDH. For stat panels, the MA must ensure integrity. A redraw is required because hemolysis cannot be corrected by spinning and cannot be accepted even with provider approval. A patient refuses to sign the Notice of Privacy Practices, NPP. What should the MA do first? A. Refuse treatment until they sign. B. Ask 2 witnesses to sign the form. C. Contact legal services. D. Document the refusal and provide the patient a copy of the NPP. Answer: D. The patient does not have to sign the NPP. HIPAA requires the office to offer the notice and document refusal. While performing an EKG, the MA notes drifting baselines on multiple leads. What is the most likely cause? A. Broken electrode wire. B. Chest hair obstructing electrode adhesion. C. Electrical outlet interference. D. Patient's deep breathing pattern. Answer: D. Wandering baseline is commonly due to respiration movement. AC interference causes uniform spikes. Loose leads or hair cause artifact, not drifting baselines. A child receives a vaccine and instantly develops hoarseness, hives, and wheezing. What is the first action? A. Administer diphenhydramine. B. Inject epinephrine IM. C. Apply oxygen by nasal cannula. D. Call emergency services. Answer: B. Anaphylaxis requires immediate intramuscular epinephrine before any adjunct therapy. A provider instructs an MA to code a procedure at a higher level to increase reimbursement. What should the MA do? A. Follow the instruction. B. Verify with the billing department. C. Decline and report through compliance channels. D. Ask the provider for written approval. Answer: C. Upcoding is illegal. MA must refuse and report to the compliance officer. A patient's blood pressure reads 168/98, but the MA notices the cuff is one size too small. What should the MA do next? A. Record the current reading as measured. B. Repeat BP using correct cuff size. C. Ask the patient to relax and recheck with the same cuff. D. Take BP on the opposite arm. Answer: B. A too small cuff falsely elevates BP. Correct equipment must be used before documenting. A urine specimen for culture is left at room temperature for 3 hours. What effect will this most likely cause? A. Decreased bacterial counts. B. Increased bacterial growth. C. Increased specific gravity. D. False negative leukocyte esterase. Answer: B. Bacteria multiply at room temperature, invalidating culture analysis. When preparing an injection of a multi-dose vial, the MA sees cloudy particles floating inside. What is the correct action? A. Roll the vial gently. B. Warm it to distribute particles. C. Discard immediately. D. Filter before administration. Answer: C. Particulates indicate contamination or instability. The vial must never be used. A medical assistant schedules a patient for a diagnostic test but accidentally reveals the patient's condition to a family member. This violates: A. OSHA. B. CLIA. C. HIPAA privacy rule. D. Stark law. Answer: C. Disclosing medical information without authorization violates HIPAA privacy requirements. A provider orders a medication Q for HPRN fever. The MA preparing to administer must clarify the order because A. PRN cannot be combined with time intervals. B. The order lacks maximum dosing frequency. C. Fever must be defined in Celsius. D. Only RNs can administer PRN meds. Answer: B. PRN orders must include maximum allowable frequency to ensure safe dosing. A patient taking warfarin arrives for a fingerstick INR test but reports taking double doses for 2 days. What should the MA do first? A. Perform the INR test. B. Notify the provider immediately. C. Delay testing for 48 hours. D. Tell the patient to resume normal dosing. Answer: B. Warfarin overdose poses bleeding risk. Provider must be alerted before any further actions. During venipuncture, blood flow stops abruptly even though the needle is inserted. What is the most likely cause? A. Tube vacuum failure. B. Patient dehydration. C. Needle bevel against vein wall. D. Low tourniquet pressure. Answer: C. Bevel obstruction is common when the needle rests against the wall. Slight repositioning restores flow. A patient reports dizziness after a blood draw. What is the MA's priority action? A. Lower the patient's head between knees. B. Apply cold compress. C. Offer water. D. Document the episode. Answer: A. To prevent syncope, blood flow to brain must be restored. Documentation occurs afterward. A specimen requiring chain of custody is missing the collector's signature. The MA should: A. Have the patient sign instead. B. Release the specimen with annotation. C. Reject the specimen and recollect. D. Add the signature later. Answer: C. Chain of custody errors invalidate forensic specimens. Recollection is mandatory. A medical assistant notes the crash cart's AED battery is past its expiration date. What is the correct action? A. Replace battery immediately and document. B. Notify the provider only. C. Leave it until next monthly inspection. D. Tag the AED but leave unchanged. Answer: A. Emergency equipment must be operational at all times. Expired AED batteries are replaced instantly. A patient expresses suicidal intent during intake. The MA should: A. Keep the conversation confidential. B. Alert the provider immediately and stay with the patient. C. Ask for written consent to share the information. D. Schedule a follow-up visit. Answer: B. Threats to self-override confidentiality. MA must ensure patient safety until provider arrives. A sealed sterile instrument pack appears moist. The MA should: A. Dry it and store it. B. Use it immediately. C. Re-sterilize after repackaging. D. Disinfect with alcohol. Answer: C. Moisture compromises sterility. The pack must be completely reprocessed. During medication reconciliation, a patient reports herbal supplements not listed on the chart. The MA must: A. Ignore them unless prescribed. B. Add them to the medication list. C. Recommend discontinuation. D. Report only to pharmacy. Answer: B. Supplements interact with medications. They must be included in the full medication profile. A clinic implements a new EHR system. What is the MA's first responsibility for patient safety? A. Customize shortcuts. B. Verify accuracy of migrated patient data. C. Edit system templates. D. Disable unnecessary alerts. Answer B. Migrated data may contain errors. Verification preserves continuity of care. A patient requests access to their own medical record. The MA should: A. Release immediately without verification. B. Refuse due to confidentiality. C. Require provider approval. D. Obtain identity verification and follow facility policy. Answer D. HIPAA allows patient access. Identity and policy procedures must be followed. A child's vaccine VIS date does not match the lot number recorded. What must the MA do first? A. Administer and correct later. B. Match documentation to the correct vaccine lot. C. Discard the vaccine. D. Delay the visit. Answer B. Documentation accuracy is essential. VIS version must correspond to the administered lot. A provider dictates increased dosage 50%, but the MA is responsible for entering the order. The MA should: A. Calculate and enter the new dose. B. Ask pharmacy for correct dose. C. Clarify with the provider for exact numeric value. D. Use standard conversion tables. Answer C. MAs cannot calculate medication changes without explicit numeric provider orders. A patient's wound culture grows MRSA. What is the most appropriate MA action? A. Place patient in airborne isolation. B. Use contact precautions for all wound care. C. Avoid wearing gloves unless drainage present. D. Request repeat culture. Answer B. MRSA requires contact precautions with gloves and gown. A patient receiving nebulizer treatment becomes tachycardic and tremulous. The MA should suspect: A. Equipment malfunction. B. Pulmonary edema. C. Hypoglycemia. D. Bronchodilator adverse effect. Answer D. Beta agonist nebulizers, albuterol, cause tremors and tachycardia. An MA notices a numeric transposition error in a CBC previously submitted. What is the correct initial step? A. Rewrite the report. B. Notify the provider and follow correction protocol. C. Delete the entry. D. Let the lab adjust results. Answer B. Medical record corrections must follow traceable amendment protocols. When performing spirometry, the patient repeatedly coughs mid-exhalation. The MA should: A. Accept best attempt. B. Encourage rapid shallow breaths. C. Allow rest, then repeat until a smooth exhalation occurs. D. Reduce the test duration. Answer C. Coughing invalidates results. Rest and repeat ensures accuracy. A patient with latex allergy needs venipuncture. Which item must be replaced first? A. Tourniquet. B. Adhesive bandage. C. Cotton ball. D. Alcohol swab. Answer A. Latex tourniquets pose immediate exposure risk. Non-latex alternatives must be used. A patient with dementia refuses vital signs. What is the MA's first approach? A. Force the measurement. B. Re-explain calmly and attempt again later. C. Document refusal only. D. Call EMS. Answer B. Gentle redirection is standard. Forced care is inappropriate. During pediatric dosing, the MA notes the provider ordered mg/kg but omitted the patient's weight. The MA should A. Estimate weight. B. Weigh the child before continuing. C. Ask parent for weight. D. Calculate average dose. Answer B. Accurate weight is required to calculate correct mg/kg dosing. A medical assistant finds expired reagent strips in the urinalysis station. The correct action is to A. Use them until new strips arrive. B. Save them for training. C. Continue using only for screening. D. Remove and document disposal. Answer D. Expired diagnostic materials are unsafe, disposal and documentation required. When measuring a patient's pulse deficit, the MA must A. Count radial pulse only. B. Compare apical and radial pulses simultaneously. C. Take brachial and femoral pulses. D. Use automated equipment. Answer B. Pulse deficit is the difference between apical and radial pulses. A patient exhibits cyanosis and shallow respirations. The MA should first A. Check blood pressure. B. Place pulse oximeter without intervention. C. Call the pharmacy. D. Administer oxygen if permitted. Answer D. Oxygenation is priority in respiratory distress. A highly anxious patient's BP fluctuates widely on repeat measurements. This is most likely due to A. Incorrect cuff size. B. White coat effect. C. Valve malfunction. D. Arrhythmia. Answer B. Anxiety can cause significant BP variations. A lab sends a critical potassium of 6.9 milliequivalent/L. The MA's first step is A. Document and wait for provider. B. Call the patient. C. Notify the provider immediately. D. Repeat the test. Answer C. Critical values must be reported urgently for immediate intervention. A patient needs a clean catch sample but contaminates the first attempt. The MA should A. Report contaminated sample. B. Instruct and repeat collection. C. Use the contaminated sample for urinalysis. D. Delay test for another day. Answer B. Clean catch requires recollection if contamination occurs. An MA notices a coworker accessing patient records without involvement in care. This is A. Acceptable for learning. B. Allowed under HIPAA minimum necessary. C. A breach requiring reporting. D. Allowed with verbal permission. Answer C. Unauthorized access is a HIPAA breach. A patient receiving an IM injection complains of radiating tingling. The MA should A. Inject faster. B. Withdraw needle immediately. C. Finish injection. D. Massage injection site. Answer B. Tingling indicates nerve involvement. IM injections must stop immediately. A provider orders hematocrit by microhematocrit method. The MA should ensure capillary tubes are A. Unsealed. B. Filled halfway. C. Sealed and centrifuged properly. D. Placed horizontally. Answer C. Proper sealing and centrifugation avoid sample loss and ensure accurate HCT. A patient with C. difficile arrives at the clinic. What is essential? A. Hand sanitizer use only. B. Alcohol wipes. C. Soap and water hand washing. D. No precautions needed. Answer: C. C. Diff spores are resistant to alcohol, soap and water required. A patient needs orthostatic vitals. What must the MA do first? A. Measure BP lying, sitting, standing. B. Have patient lie for 5 minutes. C. Take standing BP only. D. Check apical pulse first. Answer: B. Orthostatic testing begins after resting supine for 5 minutes. A patient with new diabetes is unsure how to use a glucometer. The MA's best teaching method is: A. Provide written instructions only. B. Explain verbally. C. Direct patient to online video. D. Demonstrate and have patient return demonstrate. Answer: D. Return demonstration ensures understanding and competency. A patient's blood specimen for coagulation study clots in the tube. The cause is most likely: A. Overfilling. B. Underfilling and incorrect anticoagulant ratio. C. Tube inversion. D. Automatic analyzer error. Answer: B. Blue top tubes require exact fill, incorrect ratio causes clotting. A patient faints after a procedure and strikes their head. The MA must document the incident. A. In the medical record only. B. In the incident report only. C. In both the medical record and incident report. D. Not at all. Answer: C. Clinical details go in the medical record, administrative details in incident report. An MA prepares to sterilize instruments in an autoclave. Packs must be placed: A. Tightly packed together. B. On edge with space for steam circulation. C. Flat and overlapping. D. Near the drain only. Answer: B. Steam must circulate fully for effective sterilization. A patient is placed in the Sims position for which procedure? A. Abdominal exam. B. Rectal examination. C. EKG. D. Eye irrigation. Answer: B. Sims is used for rectal exams and enemas. A patient on digoxin presents with nausea and visual halos. The MA should: A. Ask for refill history. B. Notify provider immediately. C. Recheck vitals. D. Provide water. Answer: D. Visual halos indicate possible digoxin toxicity requiring urgent provider review. A patient reports having no insurance but requests vaccines. What is the MA's best action? A. Refuse vaccination. B. Refer to federal state vaccine assistance programs. C. Administer without documentation. D. Charge full price. Answer: B. Programs like VFC provide affordable vaccines for uninsured patients. A chemical splash occurs in the MA's eyes. What is the first step? A. Report incident. B. Seek ER care. C. Rinse eyes at eye wash station for 15 minutes. D. Call supervisor. Answer: C. Immediate irrigation is essential to prevent damage. A patient's lab results were filed under another patient's chart. The MA should: A. Delete both records. B. Correct the misfile, document, and notify compliance. C. Leave as is. D. Send new results to both patients. Answer: B. Misfiled PHI is a HIPAA incident requiring correction and reporting. During triage, a patient has slurred speech and unilateral weakness. The MA should first A. Call the pharmacy. B. Perform a full assessment. C. Activate emergency response immediately. D. Reassure the patient. Answer: C. Symptoms suggest stroke. Activating emergency response is the priority.